The G20 Health Ministers meeting in Polokwane discussed several key issues, including ways of reducing new HIV/AIDS infections by 2030 and to fight malaria and TB. They've also discussed about the impact of climate change. Health Minister Dr. Aaron Motsoaledi, however, says no declaration was signed as the United States of America rejected almost all the key issues.
We don't have a declaration. We have got what you call a minister statement. In terms of the rules of G20, if just one country is not in agreement with the issues that we have raised, then you can't have a declaration, but a minister statement. What I was reading here was a minister statement because the US have rejected everything I'm saying now except the issue or some issues in fighting the NCDs. Otherwise, all the other issues they've rejected. I forgot the issue of even climate change on health. They don't believe there's any climate change. They don't believe in pandemic preparedness fight. In fact, right from the beginning, they told us even the theme, they don't agree with it. The theme of solidarity, equity, and sustainability. In fact, they told us when we started that if any declaration has got the word equity, solidarity, they are not going to agree.
Motsoaledi says one country's refusal to sign has affected the final decisions, as there must be full consensus.
It simply means whatever the declaration can have won't include health declaration beyond the fact that it's a chairperson statement, because the overwhelming majority of these countries have accepted everything. As I'm telling you, is the US. In fact, after the meeting, many countries came to me after I briefed them that we are going to issue a minister statement. They emphasized that we must write there that overwhelming majority of countries agree. These are just international conventions.
UNAIDS says the stopping of aid from the US and other Western countries has severely impacted African nations in healthcare services. The aid cuts have also led to a humanitarian crisis, with millions at risk of disease outbreaks such as TB and malaria.
In this region of Africa, the inequality in access to finance is making countries unable to launch effective responses to AIDS and other pandemics. The rapid cuts of aid have left many countries in a situation where they need to move quickly to domestic financing of their HIV responses.
The G20 Health Ministers meeting is the final one ahead of the G20 Leaders Summit in Johannesburg later this month. Katlego Nyoni, SABC News, Polokwane.